This is your fortnightly instalment where I interview a trailblazing physiotherapist that has shaped the profession we are today. In celebrating their journey, knowledge and insights, you gain the opportunity to plan and guide your own professional journey. My name is Doug Carey and welcome to Physio+10. Welcome to new and returning listeners to Physio+10. Our special guest today is Associate Professor Bronwen Ackermann. Bronwen, can you give us a bit of a background in regards to your early schooling and where you grew up?
My father was an architect, so we moved a bit actually. So I sort of swapped between here and the Gold Coast a few times. So I lived in the North Coast through my early high school years, late primary school, and then in Sydney most of mid-high school onwards. So I had a very, a mixture of things. I think it was very different growing up in the North Coast of New South Wales compared to Sydney, but it gives you a good broad perspective of life. So,
was that a country growing up, or was that like a metropolitan growing up?
Yeah, I live near a place called Terranora. It was kind of Terranora Heights, I guess they called it, like between Terranora and Murwillumbah. For anyone who knows, it's like the border town, sort of inland off Tweed Heads, and we lived on a property up there, so I had to commute down to the Big Smoke to Tweed River High School for a while, and went to Terranora Primary School. Our big claim to fame was our farm was in a very B-grade movie called Coolangatta Gold, where the guy's like an Iron Man and training running up mountains through banana trees. That was our farm.
I've seen that movie.
So yeah.
All right. And like you said, your dad was an architect. Was your mum in the health sphere?
She was a scientist. So my grandfather was a doctor. His wife was a nurse, fairly typical. They were country GP and nurse. And then back in those days, I guess those country GPs did a bit of everything, a bit of surgery, a bit of delivering babies, all the rest of it. But in that era, it wasn't considered so proper for, my mother wanted to be a doctor, but she was encouraged not to do medicine. It was kind of a difficult era, I think. So one of her brothers is my uncle's a pediatrician and my aunt is a physiotherapist. I think physiotherapy was acceptable to them as a profession, but not medicine. So my mother went more into research science and then ended up teaching science.
I'm interested in asking the question. Your dad was an architect, your mum was a scientist, obviously high expectations, but they were living on a farm?
Look, it was crazy 80s. I don't know what to say. Like, I think, or 70s and 80s. I think it was this idea that, he was working in Tweed Heads and Surfers Paradise at the time, and that it's an amazing area up there because you're like a 20-minute drive from Tweed Heads, but you're on a farm in the countryside. It's getting a lot more built up now, but I could see the ocean from our house, but we were on a hill in the countryside, so it was commutable
and beautiful.
So, and gorgeous, yeah. And I think there was this kind of thing. For those of you who weren't around for the great ideas of the 80s, there was a bit of an economic boom. Those who remember the recent global financial crisis, there was a similar kind of catastrophe in the 80s. And at the time when everything seemed to be booming, people had great ideas like buy a farm and do some farming on the side for tax side perks or something like this, so that people like architects and scientists who had no business owning a farm suddenly thought that was a good idea. But yeah.
Right.
It was a lovely childhood. What can I say? I loved it. It was a very active, here I'm a physio and I ran around up and down hills, riding horses, doing this stuff all my childhood. Very, very active.
Yeah, beautiful. Siblings, are you a single or a few?
No, I've just got one younger sister.
Right. Yeah. So you're the icebreaker in the family then.
Exactly.
So was there a particular thing that sparked your interest in physiotherapy? Or I guess it could have been also medicine.
I find it ironic. I've got piles of medical cousins, like a lot of my cousins are doctors. And I think I never had an interest in medicine, I have to be honest. I think, I don't know, it just didn't call to me. Actually, I wanted to do vet science, and because we lived on this farm and bred horses and things like that. And I was all kind of fired up for that. But then one of the country vets said to me, look at you, you're a puny female. No one's going to want you to look after horses, which is what I wanted to do. You'll be putting down cats and doing things with budgerigars, just get used to the idea. And I thought that was just not at all what I thought I'd be doing. So I was sort of in a bit of a scramble looking, and I just saw physio and thought, maybe it was quite last second, to be honest. It's not like I'd done work experience or whatever. And then my mum said, oh yeah, your aunt's a physio, and your uncle's married to a physio, and there's lots of them around the place. Seems like a good thing. So I went into it fairly blind, I have to say. I just decided to give it a try. And I wasn't sure what else I wanted to do. I didn't want to do medicine. I'd decided now that vet seemed wrong because I didn't want to put down cats and dogs. And it was probably naive. I have friends who are vets my age who are doing wonderful things, and I think I was unfairly educated. But I started doing it and just found myself enjoying it as I went along. So I think it was luck in a way, but I didn't always love it. I really have to be honest about this. I sat there half the time thinking, why am I doing this? I wanted to be a vet, and I'm not sure why I'm doing physio. Go through that process of, especially when you haven't done work experience or don't really know. I mean, I could talk to my aunt about it, but
was this at your university stage, or when you started working, you weren't sure about
it? Both, to be honest. I mean, during university, because it was kind of a wild last-minute decision, I really had a wonderful year at uni. I have to say, I think they got me through it. I was just enjoying the time with them and enjoying these people so much. And it's funny, from our year, a lot of people, I think, just got on with it, enjoyed themselves and got through the degree. Then when I stopped and did my first year, I chose, we were one of the groups that didn't have to do a hospital placement, but I chose to because I thought it was a bit less scary than going cold into the real world at the time, I suppose. And, gave you a mix of things. And at the time, it didn't feel like I had a complete fit, I would say. There were lots of things I didn't mind doing. And in fact, I quite liked neurological rehab. Elements of that I really liked, but there were elements that weren't a perfect fit. And then I went over to the UK and did a whole lot of locum work in various fields. And over there, it was interesting because you did have the chance to study horse physio. They do this in the UK. I don't know if we teach it here yet, but over there they were running special courses for physios to work with horses. And I looked at them and thought, oh, maybe I should try that, and never kind of followed it up. I just found myself starting to enjoy physio. And at the time when I probably, if I really didn't like it, I should have done that. I didn't. I sort of stuck with it. And when I got back to Sydney after, I don't know, just these various locums in the UK, a very random moment in time led me to working with this Sydney physio called Francine St. George that some of you might know. And I was still a little bit wishy-washy, thinking, I've been doing all this general physio. Do I want to do vet, or do I want to do this, that, and the other? And suddenly found myself plunged into a very high-level kind of sports physio clinic where we actually saw quite a lot of performing artists. And it was just a complete shock. I hadn't worked anywhere quite like that. And certainly with someone, I know you have talked about things before, like who influenced you. And I think Francine had an effect on a lot of us who worked there, with telling us, you've had this solid training, you've had this very, good science background and a good way of trying to assess, evaluate people, look for things like possible other pathologies and so forth, yellow, red flags, stuff like that. But she said you need to take the blinkers off and think about how you can be a good scientist. You can use the information but you can use anatomy, you can build up other tools in your toolbox, and really take the blinkers off and start looking at what you can do with the skills you have and how you can build the skills you have to do even more. And this was really important for me, actually. It just made me think, I don't know why I hadn't done that, to be honest. I think we get... we come out with a solid training, but not kind of an idea of growing and flourishing skills while still keeping them very grounded in science and evidence. Like, I think some people go off in wild tangents occasionally, following a concept that's not terribly grounded in logic and facts or science. And for example, all of us working there did postgraduate anatomy again with, there used to be this course that Sydney Uni ran that they don't run anymore, but where you could go and do your own dissection, have 6 months of really applied anatomy and start thinking, wow, when I really go back to this and really understand all the bits and the pieces and how it works together and combining them, it suddenly opens everything up again for you. You think, oh, okay, I have some tools in my toolbox. I can keep adding tools to my toolbox, but I can actually use a lot of the information I have to start to explore, if you like, into some of the unexplored realms, like why are these people having the problems they're having? Is there a way I can use my knowledge to try and understand it better, to be able to do my job better?
So would you say that that type of work enabled you to think, here's a person, here's a problem, I have the skills to solve it, but I'm not quite sure, but I'm happy to just do explore? Like, it was almost giving you license to explore your knowledge and apply it in a way that you didn't have before?
Right, and often you had very unorthodox things. Like, so when you deal, I mean, you might know this, but when you deal with very elite people, like, say, for example, I used to use this example, I'll use it again now, but one of the national aerobics team was coming to see me, and they were saying to me, after I do about 30 left arm, like one arm push-ups, I start to get a little twinge here. And, you're looking at them thinking, 30 left arm push-ups, wow, in my dreams, like, could I do that? But what you're looking for is the kind of 1% thing that's causing a problem, so that when you compound it with repetition, it might be a problem. So pushed you, and they sort of said that's what they want you to try and help them with. And I think you then get out of the kind of general mode. You think, oh, okay, well, let's just try and think about this. What are they doing that's just a little bit outside the bounds of I guess normal enough that 30 reps are going to change it. And, in this day and age, when I'm doing all this work with elite musicians, I'm often dealing in this kind of problems that might seem to other people inconsequential or small, like, these are already very famous musicians often that have something that's bugging them that is a problem after a certain amount of exposure and things. And really, it's about us seeing if we can look more closely or see these sort of patterns that under conditions of, well, sometimes under conditions of stress, they might change, or that, as I said, we can look as far as a 1% thing. Certainly not when you first graduate. I think when you first graduate, you need to just get some tools in your toolbox and learn, I guess, the kind of perhaps foundation, or shall we say maybe recipes you're given at university are there to give you a framework, but you need to really build on that in a way that appeals to you.
Yeah. How long were you at Francine's practice for?
I was there, let me think. So I was there for maybe a couple of years the first time. Then I went over to Canada and worked. So I'd been to London and worked, and then I decided to go back to Canada. I wasn't quite done with traveling then, and came back and worked there again for another year and a half or two. So maybe 3 or 4 years,
And
all in
how
all.
long?
And by the
Sorry, go on.
no, that's okay. I just meant by the time I ended with Francine's, I was seeing more and more artists, like I was sort of getting sent the artist load as opposed to, I mean, I for sure saw lots of athletes as well, but we were doing really interesting things like screening for the Sydney Actors Centre and seeing a lot of musical and dance groups and various other performing artists through Sydney. She had a big performing arts population. I saw a lot of that and found it fascinating. And there's like nothing you can find in your books at the time, or you don't have any knowledge base of what to deal with these people that are, I don't know, tap dancing and jumping over chairs, and or people that are, playing 6 hours of saxophone in smoky jazz bars at night and having issues. These things were not in my training at all.
Textbooks. When you went to
Yeah.
Canada, how long were you there for, and like, where did you work, and what did you learn from being overseas?
So I was in Vancouver, and I worked in a clinic in North Vancouver. There were two clinics I worked in. The main one I worked in was actually related to chronic pain. To some long story short, which was really good experience for me. I mean, I'd seen quite a lot of complicated patients at Francine's. She had quite a reputation, so we had sort of a lot of elite people, but sometimes quite complicated cases. And one thing, back to Francine before Vancouver, because it kind of works. Like she used to, I think you come out of uni getting told you shouldn't make a diagnosis, or you can make a provisional diagnosis. And Francine used to say, this doesn't mean you shouldn't think and try and think you know what structures are affected. And I think this is really fundamental. You know, you sort of really need to think about whether it's perhaps a strain type injury, a compression type injury, like narrow it down to the main structures or levels or thing that you think the injury's at, and it totally guides your treatment. Now, when you get into things like chronic pain, like I was working at in Canada, then we're dealing a lot with, I guess, body and mind pathways as well. So this was a very useful additional skill to be much more aware of how people's perceptions of their pain and how their, I guess, fear avoidance or attitudes towards it or things like that can either perpetuate or help resolve it. So that was a very interesting place. And they did a lot more work with body-mind stuff. I mean, to be fair, Francine's also very aware of this, or was very aware of this when I was working there. But it was very good to kind of work in a very integrated practice. And these kind of, as I said, this very early days, getting this idea that from my Canada experience of trying to be aware how much the brain, if you like, our perceptions of pain and our perceptions of or patient goals or things like that can affect outcomes. And the other place I worked at in Canada, I used to help them out from time to time, was like the incredible reverse of this. It was a manip physio clinic, and in Canada at the time it was covered by Medicare, and they saw so many patients per hour. Like most of us were seeing at the manip clinic 6 to 8 patients an hour. And the thing that taught me is, what is the single most important thing that I can do for this person, because that's all I've got time for today. And you know, so it's actually an interesting thing. If you've got 10 minutes, what are you going to do? Like, it's actually, so it stops you fluffing around. I guess you just don't have, you're really trying to absolutely sharpen your clinical reasoning to be able to kind of achieve miracles in this time frame.
No, that I had a couple of years there, and that stunned me too. I had almost the same experience, one with John Oldman in Vancouver, who was very much chronic pain, and how you breathed and how you stood in your body. And then it was with Deb and Bill Trelaw, and Bill used to see patients every 6 minutes. And when I took over a locum for him, it just blew me out of the water.
I know, you've seen 48 patients by lunchtime, you think.
Yeah, talk about exhaustion.
I know. But
okay,
I think that was, so they were very different sort of things, and I think they both really helped. I came back to Francine's, but with a tighter kind of like this width, if you like, in your mindset. I think it's really good to have these experiences early, in terms of it just felt everything added and grew and opened your mind a little more to how to manage them.
Would you say that these choices you made were strategic, like you were deliberately chasing a particular idea, or they were a bit more random?
Sadly, it was really just, I would say that the things that interested me, there were places that I worked that I didn't like, that were very, I would say the places I've liked, even the high turnover place, the guys that ran it had still had a solid foundation and background and things. It was just kind of the way it was run. Where I don't like is when people have constrained thinking. I have no problem with people wanting you to show evidence. So say, for example, a lot of these good places I worked in would want to sort of say, well, this person's been coming in. Usually we had a 3-time rule, for example, at Francine's. If they weren't substantially better after 3 sessions, you had to sit down with her and explain why. Because, you know, she would just say, are you do you know what you're doing here? Are you on the right track? Or it could be something very complicated. So a lot of my very complicated patients these days is that it's not a 3-time rule, so to speak. It's a plan, and it's a understanding where we're going. And but yeah, having this idea was really, really important, to sort of think, I don't know, let yourself be challenged by patients saying, I have this problem and no one can fix it. Are you prepared to try and fix it? Not trying to get them to fit within what you can do, but try to sort of see whether you have the resources. Maybe you don't. Maybe you have to, so to speak, either refer them on or talk to other people. And I think this is a very important thing. I'm very experienced in what I do, but I have a very good, for example, very good friends who are in other specialties or in physio, who you can talk with, you can talk to each other about things. We do this, it's not like we suddenly become all-knowing. I might talk to an orthopedic surgeon friend of mine about whether he's ever seen these accessory muscles. There's a particular accessory, like anatomical anomaly, I've seen a few times now, causing problems in musicians. And it's interesting. You can talk to orthopedic surgeon friends and say, how many of these are you noticing? Like, is it just a small amount, or should I be checking for this routinely? Because it's a bit strange that it pops up now and then.
That's brilliant. I love the anconeus epitrochlearis when it comes to elbow pain. And as you say, anatomical anomalies.
That was a little blighter. I think it's more common than we think, the epitrochlearis or the accessory anconeus. It's really, I've had it a few times. So.
Yeah. And we just don't know about it until we start looking for it. Hey, look, you've got a bit of a reputation in the world of music. How did the worlds of physio and music combine for you?
Well, I think, this is my take again on opening your own mind and taking blinkers off. I found it fascinating when I was treating musicians, thinking about it. I'd had an injury myself, a soft palate injury, when I was a kid learning the clarinet. And at the time, the doctor just laughed at me and said, well, don't play it anymore. It's obvious, And but it really hadn't progressed a lot when I started working with musicians. I was sort of working with them, talking about issues they had, and found it fascinating. Like, I love music, so it was a very interesting thing to work with. But way back in 1995, I got asked to go with Sydney Symphony Orchestra on a international tour, and my job was to keep the orchestra on stage. And I thought, yeah, cool, sounds great. I wonder what problems they have. So I started looking, thinking, no idea. All right, there's all this stuff they get over these injuries. This doesn't really help me pack my kit, because I'd been doing things like sports physio, football physio and stuff, and you knew what you needed in your kit. You have the magic spray, the magic sponge, or the magic towel, depending on which football code you work with, and you have, some tapes and things like this. But the orchestra tour, I thought, blimey, I have no idea. Anyway, so I just packed some bibs and bobs and went away on tour. And wow, that was a very mind-opening thing. Firstly, I just honestly didn't realize how poorly musicians are prepared for their professional life in terms of physical and psychological training. I mean, it's highly pressured. You're up on stage every night in front of thousands of people, and you get no routine training in how to deal with that. Secondly, it's the most physically complicated. I don't know if you've played an instrument, but it's not easy. You can't just pick up a violin and sound like them. It takes the 10,000 hour rule takes at least 10,000 hours of regular dedicated practice to become that good. And they learn nothing about their body, really nothing at all. And so they're a very vulnerable population. And I was horrified on the first tour, thinking, wow, you're one of our best orchestras and the top performing. Here I'd been working with all these other elite sports people. And even dancers, they have class and they have still people kind of monitoring them, but the musicians don't have that at all. And I felt like the poor things, they're doing the best they can with, obviously they've had good teachers teaching them to play the violin, but they don't know how to look after themselves well at all. And I was literally shocked. And I'm sure I did everything wrong at that first tour. Like, they knew me and they knew I was well-meaning, but I'd go up to them and say, oh my God, how do you play the double bass sitting like that? You must get so much back pain. And,
I do.
Yeah, but that was what was happening, right? The funny thing was, I was saying that, and they were sneaking up to me afterwards going, how did you know I get back pain? And then you try and talk to them and say, well, there's only, you can't really sit and bend and twist like that without putting stress on the discs in your back. And you could do it this way, and start to give them kind of ideas. And then I started videoing them and showing them the videos. And look, I would say as a general rule, this was the best thing to do, and I still do it this way, that, these people are professionals who've worked, as I said, more than 10,000 hours usually on their craft. But to take a video when you perceive that, there's a way they're sitting, a way they're moving that looks like it's not ideal for straining muscles or whatever, I take the video and show them and say to them, look, from my perspective as a physio, if you sit like this, there's going to be a lot of load on your back. And, of course, there's always this sort of, I've always said like that, blah, blah. You can go through the discussions about perhaps they haven't, because often things change over time and they're not necessarily aware of it. But going up to them and saying this, and a lot of them, I was basically picking their injuries. That's what I think freaked them out, because they'd say, okay, how did you know I had a wrist injury? How did you know I had a back injury? And I said, well, the way you're moving or the way you're sitting. I mean, I have always liked biomechanics, I will say that. So, to apply it into sort of music took a bit, but it was possible. And I think after that first tour, I went down this rabbit hole then of reading a lot of pedagogy books to try and understand what they were taught. Like, really, I think I've read more pedagogy books than a lot of musicians. But it was for me to understand, and actually there's a great Uni of New South Wales music physics website too, which was trying to understand how they were being told to move to make sound, so that when I told them how to move to not hurt themselves, the two things came together. That was my very simple and still I would maintain this is my thing now. It's trying to make the biomechanics work within what they want to do to make it sound. Lots of people have different styles of playing, and that's none of my business. My business is to try and help them play, to move within that style. So say they would have something like a high arm technique or something like this, but it's to make them able to do that with how we balance muscles, or if there's too much, if they don't realize and they've drifted into doing things in a way where you can tell they're causing stress on structures. So I sort of read a lot of that so I could try and do my job better, because this is what we do if you're working with tennis players or runners or whatever, right? We know something about the sport, so we can evolve our techniques to be logical and fit within it. And that's where I sometimes find, to be honest, some physios are not thinking very clearly when they see a musician. I can't tell you how many times people like violinists have been told to play the violin on the other side, and I think, come on, like, think about it, please don't tell me this. Like, and so, like, I think we have to, it's a wonderful opportunity to be creative in your art. This is, I think, where I started to realize we have great potential to be creative, but using our knowledge of anatomy, using our understanding of various pathophysiologies and advances in management to try and be creative and get better at doing our craft. And that's what kind of fed me into starting to really love my profession over time, thinking, what an amazing background we get. We understand how the body moves. We understand a lot of physiological process in it. You can work with this group where there's no field there. Like, so back to your original question, there wasn't a pathway for me. I just made it. And in some ways, I think I was almost lucky that I was on my own, working a lot with lovely musicians trying to help me be more intelligent about what I did too, or more applied in what I did. Like, they'd all want to teach me how to play their instrument and tell me everything about it. And you just absorb and take it all on and try and, put it through the filter and think what things here are, useful or interesting to me, because there's some very important, like, mechanical kind of concepts, like, rebound and things like this that are very helpful in what you do to know. And I got a Churchill Fellowship in 2000, which, so I'd been on a few orchestra tours. I'd already done a PhD by then, looking at what we could do to kind of prevent injuries happening. And I picked violinists because there were a lot of injured violinists, and a bigger group for research. And this Churchill Fellowship allowed me to go overseas and travel and meet other people. And a lot of them were shocked with how much I'd been doing. They were sort of like, oh, you're doing this and you're traveling with orchestras and you're working with musicians and telling them, ways they could move better. And I was saying, well, yeah, sure. This is what we do in other facets. And so, so then I think people started, I started from those early 2000s, really collaborating a lot overseas and guiding a lot of people to kind of understand a bit better how to work with them in this way, where we're also developing new ways and pathways. And I mean, probably a very good example of that is all the orofacial internal mouth kind of rehab I've been doing lately, which the first time a trumpet player said to me, oh, I'm having all these embouchure problems, and which is the way you shape your face on the instrument. And I was like, well, go and see a speech therapist. They're like, yeah, but they're not interested. They just want to do swallowing and stuttering. And I was like madly ringing all the speeches going, come on, guys, this is your region. Come and do this. So I still tell them this all the time. But anyway, I decided I should get better at this. And, nowadays we certainly studied anatomy of this area. And, I did so much self-training and applied anatomy and applying things and learning and really trying to work with the musicians and do the best of my ability. And I've kind of got better and better at this area. I'm sure I have a long way to go still, but it's fascinating what you can learn in the process. And they, like the musicians, have always been my biggest supporters, because of course they would like to get rid of the problem. And I've always been trying to extend myself to think, is there something I could do better, or is there a way we can work this? Because you won't find it in a recipe book.
Tell us a bit more about the Churchill Fellowship. Is that something that physios achieve or undertake a bit? Yeah. And what is it about? Right.
So Churchill Fellowship is about, obviously it's a Commonwealth country kind of thing, coming out of the Churchill Foundation in the UK, but it's trying to encourage us to go and get skills or liaise with people overseas, especially if you're in a different area like me, and to try and liaise and communicate and make content and networks and bring that sort of knowledge and information back to Australia. It's a really wonderful opportunity. And actually one of the musicians strongly encouraged me to do it. So for example, for musicians, they also can get one if they want to learn a particular instrument, for example, where we don't have expertise here. And so that was amazing, because I got to see what everyone was doing overseas. I got to meet a lot of other people, see where you fit in, see where you could go. And it was just a very eye-opening thing. And I'm really, all these people I still keep in contact with. We've sort of maintained lifelong working relationships. I did a few years ago have another fellowship, this Humboldt Fellowship. So Alexander von Humboldt Foundation is a German foundation that does a similar thing within Germany. And in this case, one of the neurologists I've worked with, who I visited on my Churchill Fellowship, to be honest, wonderful man, a real expert in movement disorders in musicians. And I was lucky enough to get a Humboldt Fellowship to support working with him in Germany. So these foundations, honestly, I think I love the whole thing of continuing to learn and getting, I guess, extending your craft and never becoming stale. I mean, I think burnout or leaving the profession, if you don't do this, it's very easy to become burnt out. I mean, I can see, I know many people who have, and I think I've tried to evolve and move and do different things. So I've kind of always maintained my physio. But now, for example, I also teach anatomy and I do research, and I still do physio, seeing musicians, and still working on trying to solve hard problems.
I don't normally do this, but I'm going to read out a few of your achievements just to give the listeners a bit of an idea about, I guess, where you've gone as a vanguard person in the field of physio. So we've got here, develop the Australian evidence-based guidelines for best management of occupational injuries in musicians, editor of Medical Problems of Performing Arts, chair of the International Liaison Committee and the Education Committee in the US-based Performing Arts Medicine Association. You've been involved in implementing the Australian National Academy of Music health-based programs for musicians, and you designed and authored the first intensive training course in performing arts medicine. So I really just wanted to, because that just really captures a lot of what you're saying, that this area was a new area. You had a template of anatomy, biomechanics, tissue injury, profiles, healing responses, that sort of stuff. And you just overlaid that over a completely new niche area, which is musicians and performing artists. And you sort of said, well, I've got the baseline, but I don't understand the concept. So I need to upskill myself in this area. What do these guys do and how does that apply to my knowledge base? So I just had this impression of like, almost like we're physios, we're almost like camelons. We have the capacity to blend what we've got, our core substance, into different areas. I'm thinking for myself, I live in a farming community, and I've really realized that to integrate with that farming community and apply my knowledge as a physio, I need to almost be a part farmer. I need to understand what they do, the pressures they're under, the deadlines they're working towards, the machinery that they utilize. And by understanding that and being able to speak their language, they're much more willing to take on board changes that are going to help them, but they just take it on board because they know that you know what they're going through and how you're just trying to help them.
Absolutely.
And it sounds like what you're saying is very similar. How would you
Well,
say?
I think there's two things. I think going on tour was a very good thing to be under the highest stress because, I mean, there is things like Carnegie Hall syndrome where it's amazing the amount of people who freak out backstage in that place.
I can imagine that. How would you say is the level of health literacy or health awareness amongst performing artists and musicians?
It's a big thing I've been working on at the moment. We've actually set up this International Musicians Health Literacy Consortium. Can you believe it? But it's such a big problem. So for years and years, I mean, I've been working in this area a lot. The musicians in Australia, a lot of them would know me well. And still I will hear from them a bit late about injuries and say, why did you wait? Why, you know me? Why didn't you come and ask me about this? Oh, well, I thought I should be able to fix it myself. And I think, why? Why do you think this? Like, I mean, I don't think I should be able to play a Beethoven sonata because I heard it on the radio once. Like, I'm just not sure why you think that's possible. Please tell me there's not such thing. I think they feel that they should be able to sort it out. I mean, they're really trying to do this. So yeah, it's the health literacy. We're working on this a lot at the moment. One of the frustrating things is a lot of musicians will say to you, we should have learnt this at uni, we should have learnt this in our training. But how do we get it into their training? I've been advocating for this for years, and so a lot of the institutions now have variable programs. I wrote a whole big e-health curriculum, but a lot of them don't want to use, like, specifically for musicians. And but a lot of them don't want to use this because it takes time out of just playing the instrument. I keep saying, yeah, but the idea is if you learn about this, you can play it better for longer. This is the idea, you don't actually run into injury.
And productivity.
And so so a lot of them will do token things like a few lectures in the orientation week and things. And I've just submitted something at the moment, but what we find is, of course, the students come in super enthusiastic and, you're in this competitive hothouse of people playing, and it's kind of the old mantra of the more you play, the more the more brilliant you'll be, or something goes on, rather than sort of understanding that it's a combination of smart practice as well as good instruction and all these things, but really not more is not more necessarily. And just trying to, what we're seeing is that the people who become interested in health have an injury and then think, oh my God, what could I have done? And this to me is really not ideal. We want to stop people getting injured in the first place and have this positive approach to the body. There's this great word, salutogenesis, like this idea of maintenance of good health through your training should be what we're aspiring for, not trying to pick up pieces and put them back together, because it's very devastating for students to think, I don't know what's happening, it's just happening to me, and they're all a bit scared about talking about it. I get quite a lot of rather sad stories from musicians who've been told by their teacher, well, you're just not practicing hard enough, or this kind of thing, and really they've had something that could have been addressed with a collaborative kind of way with a health person trying to help them get around the physical side so they can then do their performance side. So we're working a lot on trying to figure out the best way to get musicians resources. There are some resources that most of the performing arts health websites have as a starting point, but and we're actually working a lot internationally, I guess, with music educators, trying to get this positively portrayed in music. One of the really ironic things is when you say to talk to musicians about health, they immediately think of bad health. They don't think of good health, right? They sort of think, oh no, I haven't had an injury, it doesn't affect me. I think, no, what we're talking about is like keeping yourself great, as good as you can forever. Like, okay, we're still going to have times, if you look at any elite athlete, they're still going to have times, even Mr. Superstar Roger Federer occasionally has injuries. It's not that he's not a beautiful tennis player. It's just that this can happen, but you manage them well, you recover properly, and then return. You don't just ignore it and hope it goes away because you're terrified about it. And there's a lot of stigma about injury in music, and this is very unhelpful. It's got better with the physical side since I've been bleating on about it for like over 20 years, and the psychological side still has a way to go. But this stigma where you say to people, no, we need to be at this front, like learning strategies to manage state of arousal, if you like, in your stress levels and things like this is totally possible, as well as trying to manage, flexibility and muscle balance and things like this. The more strategies you have, the better you go into the future. So they just only learn about it through suffering an injury or suffering stress, and then see someone and then start to work on strategies. And, really we need to do better with this. Try and get them a little more prepared. So I would say we're trying at the moment to start to provide resources to music educators. It would be great to get the administrations on board, but anyone who's worked in academic environments knows there's a lot of, conflicting demands and politics that sometimes makes it complex. So some of them are great. At least if we can get music educators start to provide resources for them where they can upskill. We just hope to get this cultural shift.
Yeah, I mean, in some ways, I was thinking that when you mentioned that about the musicians being not educated physically, I was thinking that makes me think about middle and long distance runners. Like, you definitely running more is not running better. You have to teach them to run smarter, but they've also got this massive performance thing, like as you say, the stress arousal system. And from my perspective, that's going to affect their sleep, and that's going to affect everything as well.
Totally. Sorry. Yeah, this is one thing, for example, on tour. I mean, these orchestras fly to another country and they usually get given maybe one night to recover and then they're off. I think they're incredible that they can manage this. They're all half jet lagged the first few concerts, that's for sure. But what you're saying with the arousal thing, I think this is also good for physios to remember. When you're dealing with performers of any kind, they're performing at a different level from your rehab state. Like I usually say, it's a bit of a stupid thing to say, but say for musicians before they go back to performance, they kind of need to be 110% better, because how they're playing in their practice room is not as intense as on stage, and when it's soloists, it's almost another level again.
Yeah, definitely.
They're very exposed.
Turning more to your sort of your physio sort of stuff, what would you say is the number one goal that you're always trying to achieve with these performing artists?
I think the really important thing, I did think about this a lot, I think the really important thing is to be somewhat flexible with our goals. Like, I will be as pedantic as they want me to be with getting every little nuanced movement as perfect as we can make it, if that's what they are happy to do. And a lot of them push me hard in this way. Yes, but when I'm playing this particular Chopin etude, there's still a slight something in my fourth finger, and we're trying to work on where the block and the flow is happening, and really complicated kind of muscle synergy stuff that takes a while, and working with these people to develop is kind of really remembering all the fine-tuning stuff requires this whole kinetic chain to make it work, and getting this all flowing well. And they often, again, musicians don't necessarily learn about this flow of movement from center outwards in a good way. They talk about flow in a sort of psychological and general sense, but they don't get really given any detailed information on it. But also goal setting is very important. So some musicians, so say, for example, with this, I've been doing a lot of work retraining this condition called focal dystonia, which is really difficult. But so I was doing this in Germany, and one of the musicians in Berlin, for example, was getting, like what you can do is they can get Botox in the overactive muscles, which calms them down enough they can kind of get by. But it generally worsens with this over time. This is not it's a short-term solution. They need gradually more and more Botox, and it's not a cure. It kind of puts a Band-Aid on it, but you gradually need a bigger Band-Aid. So I've been working on a program of retraining and reorganizing movement, and this does return the skills gradually, but it's quite they have to be dedicated to do this, because to try and remap these sort of synergies and movements, like the music stays there, and in a lot of ways their old technique is in there, but they've developed all these detours that we have to keep putting them back on the right track. But one of them, for example, still wanted to just get Botox to be able to perform, but really wanted to do the exercises just to feel reconnected to their hand, for example. And you think, this is our job really at the end of the day, is trying to work with them on their goals. Like, if they want to retrain back to professional performance, and some of them have been able to do this successfully, great, I will be there with them and be that sort of picky person looking for the 1%. But if they want to just enjoy doing certain things with their hand and moving their body in a way that feels more whole again and things, I will work with them with that. I think this is one of the big challenges as a physio, if you like, is sometimes, why are we here? We're trying to help them do what they want to be able to do to the best of our ability. Sometimes we need other help, sometimes we just can't get them there on our own. Other times they don't want to get to where we think they could get to, and you have to respect that this is, you give them the option, you talk about what it will involve, and then work with them on that. I don't know if that exactly answered your question, but it's sort of a roundabout way of answering it.
Yeah.
Yeah.
What would you say has been one of the hardest things that you've learned as a physio, managing these high performance artists?
As I said, I think aligning your goals to what they want. I think one of always the hard things that we all know as a physio is that you can lead a horse to water, but you can't necessarily make them drink. You think I have to say, on tour, being able to be there like some kind of very bossy physio and make everyone do exactly what I want them to do, especially if they have an injury. It's amazing. It's like miraculous. You think, wow, when I have them under here, I can think it's amazing what you can do. But so I think that's sometimes a hard thing in physio, is that I don't have a problem with the fact we can't always get everyone better, whether it's your own approach or whether it's outside the scope of your practice or things like that, so long as we're honest and upfront and say, I don't feel like I'm addressing this. So I don't have a problem with that. I also don't have a problem with working together. Sometimes two heads are better than one, especially in my area, where if I get a French horn player to help me with some complicated tongue problem, it's a win-win, if you know what I mean. So, so I think sometimes the hard thing can be that they just simply don't want to do what you're asking them, or think that what they need to do. And sometimes you have to let go and think maybe you're better to see someone else if this is not the pathway you want to go down.
Yeah. If you could step back to your younger self, are there some bits of advice you'd like to pass on?
I think just I still like the advice I was given, in the sense that I think what you need to appreciate is what you've been given is this huge foundational amount of information, but skills themselves, they're in the old days of our training with the Maitlands and Mackenzies and whoever's of the world, they kind of worked out a theory for what they did that they found worked. And then lots of people now running away trying to find out what's actually going on. And maybe we'll never know all the mechanisms, but build your foundation on something sensible. Be prepared to work with, especially like me, if you're working in performance domains, be prepared to work with the performers and have respect for them. I can tell you lots of them get very cranky at physios telling them they should just get a better technique or something, and they're like an international soloist. I don't do this. I work with them and try and think, okay, how can we work together to resolve this problem? You can use their skills in the process, and collaborative things are really what are we doing as physios? We are it's not us trying to get them better, it's we are working together for a desired outcome. And I think it's probably that's the biggest thing as a young physio. Just don't think you're doing something to them. Think that you're working together to resolve an issue, and you have to be prepared to widen your horizon sometimes to understand their issue better. But you also have to sometimes accept that your recipe may need refinement. You need to add a pinch of salt.
Yeah. And looking forward, like, what are you looking at doing yourself for the next sort of 5 years?
Look, at the moment, I think I'm in this interesting state where I'm still, I guess I'm trying to take a little more leadership in like, say, things like this musician's health literacy thing. I'm trying to start to train people in these concepts of retraining. I have various projects that I still would like to do in relation to some of these very complex, difficult conditions that I think might be a good thing to give to the field. So I think my swing now is from being madly researching and generating things to try and teach and pass on and foster and mentor a lot more, as well as I said, there are some very complicated issues that we're trying to better understand now, that like especially in relation to some of these dystonia, like these complicated sensory motor disorders, that it's quite a lot of information coming at a lot of angles of this, that we can perhaps help everyone else by coming up with some suggested pathways and ways to build off. And I'd say, like, people like us that have this experience into new domains, I always think that what we're providing and putting out there hopefully is a springboard for everyone else, like, to use or refine or make better. And
And do you see that happening sort of through a university pathway, or through teaching?
Not necessarily. Athlete? Yeah, so mostly I've run postgrad workshops. The universities these days are not, unfortunately, they're not easy to run very specialised things in. That's not how big universities like Sydney University are running. They're more doing the kind of the big groundwork courses, but not super specialised stuff. So yeah, for example, I'm going back to Germany and going to run some workshops there specifically on retraining, and I need to start just setting these up myself. I was kind of hopeful to run it more through an institution or something, just to it would make a certain amount of sense, but it's not the way institutions are going. So
yeah. And just out of interest, like, what does your day or your week look like? Like, how do you spend it academically or professionally or clinically? What is happening?
So we have this sort of I work at the moment full-time at uni, and it's a 40-40-20 thing where you do 40% research, 40% teaching, 20% admin. Some of us that are clinical academics are able to get an extra 20% a week towards clinical stuff. So in that 20%, I see patients. The one thing with COVID that's been an unexpected, I don't know if it's good or bad, is that I have a lot of international Zoom kind of clients, and when I can, I will get them to call in with their own health provider there. Sometimes it's okay to do stuff that's more related to very particular musical skills. So it's setting up cameras around instruments and things. But yeah, so my typical week's very varied. And again, talking about where you might see yourself going, I don't think I could do full-time clinical physio anymore because I like the research a lot and actually really enjoy teaching. I don't know, the balance is a bit of a shifting thing, but I like the mix. And I love seeing patients still. For me, it's really interesting. It's such a satisfying part of me. I don't know. And it's also very there, you can see someone, you can work with them in your area, you're good at what you do. It's a very satisfying thing to be a physio.
Yeah. And just on that note, like, where do you see the physio, where would you like to see our profession going in the next few years?
I would like us to be really looking at our strengths in this way. I sometimes feel we tend to be hard on each other. Perhaps this is an Australian thing too, and I think we should be proud of what Australian physios are able to achieve and look at branching out and I guess having better support system for new physios, like our new physios feeling like they can't see a chance for mentoring, or they can't see a chance to adapt into different directions because it's there, and there are many people who can help, but you don't come out of uni with that skill. So just remember that when you come out of uni, you have the foundations, but you have to kind of look at the possible pathways, go and look at what people are doing, talk to them, and because then I can see physio continuing to flourish. I can't really see why it shouldn't. But I think if you come out and you think you know it all, that's not the way to think about it. I think you have a good framework from which to build your repertoire, so to speak. I think we have a lot to offer and a lot to work in, and consider like going internationally and seeing how much you actually do know and how much you can work and help other people.
Great. Thank you so much for joining us today on Physio+10, Bronwen. It's been an absolute pleasure.
No problem.
And I've loved speaking to you and hearing about, you are literally the vanguard in this niche area of performing arts and musicians, and you've done so much for the profession to combine the two things together. So thank you very much.
No problem. Thanks, Doug.
Thanks so much for listening to this episode of Physio+10, in which I trust you gained some valuable insights. It'd be awesome if you could leave your 2 cents worth as a review or rating of this podcast, and I look forward to sharing the story of another trailblazing physiotherapist with you in 2 weeks' time. Stay safe. Bye for now.